All right, today we're going to talk about a disease, one that's literally brought down empires and completely reshaped cities. It's so fast, so swift, it even got a pretty terrifying nickname. So let's get right into it. What exactly is cholera?
But before we get to the definition, I've got a question for you. Have you ever heard of something called the Blue Death? I mean, it sounds like something straight out of a horror movie, right? But it was a very real nickname for a disease so incredibly dehydrating, it could literally turn a person's skin a sort of bluish-gray color. And that disease, you guessed it, was cholera.
Okay, so what are we really talking about when we say cholera? Let's break it down with a simple, straightforward definition. So, at its most basic level, cholera is a really, really severe diarrheal illness. It all starts with an infection in the intestine, and the scary part is how fast it works. We're talking about fluid loss so rapid that if you don't treat it, it can be fatal within just a few hours. That speed is what makes it so incredibly dangerous. For centuries, people saw the awful effects of cholera, but they had absolutely no clue what was causing it. It was this terrifying, invisible enemy. So now let's zoom way in and find the tiny little troublemaker responsible for all this. I mean, can you just imagine living back then? A deadly disease just sweeps through your city, and nobody can see or even understand what they're fighting against. The cause was totally invisible, and that, of course, just made it a million times more scary. And here it is. This is our culprit, a bacterium called Vibrio cholerae. Now, if there's one thing you need to remember from this, it's where this little guy hangs out. It's found in water or food that's been contaminated by feces from someone who's already infected. And that one simple fact, well, that's the absolute key to understanding how this thing spreads like wildfire. Okay, so we've identified the microscopic bad guy. But how does it get around? How does it go from one person to the next and create these massive, devastating outbreaks? Well, it all boils down to this really vicious cycle. This breaks it down perfectly. Check this out. Step 1, contamination. Waste from someone who's sick gets into the water supply. Simple enough. Step 2, ingestion. Someone else comes along and drinks that contaminated water. Step 3, infection. The bacteria just loves its new home and starts multiplying like crazy inside them. And finally, step 4, transmission. Now that new person is sick and their waste can get into the water, starting the whole terrible cycle all over again. It's called the fecal-oral route, and it's exactly why clean water and good sanitation are, absolutely non-negotiable for public health. And all of this cycle, it actually leads us to one of the greatest detective stories in the history of medicine. Seriously, the fight against cholera is basically the origin story for the whole field we now call epidemiology. The science of being a disease detective. So let's paint a picture. The year is 1854. The place? London. And the city is just gripped by fear. Another horrible cholera outbreak is tearing through the streets. People are dying left and right, panic is everywhere. And the best idea the doctors had at the time was that it was spreading through bad air or miasma. Yeah, that theory wasn't exactly helping stop the dying. But then our hero enters the scene, a physician named John Snow. And he just wasn't buying the bad air theory. It didn't make sense to him. So he did something that was, for the time, totally radical. He went out and he started talking to people. And then he mapped it. He put a dot on a map for every single death in the Soho neighborhood. And look at this timeline. He worked so fast, in just a matter of days, a pattern jumped right off the page. The deaths weren't random at all. They were all clustered around a single public water pump on Broad Street. And this is the really amazing part. Remember, Snow didn't have a microscope. He couldn't see the bacteria. But what he had was data. And his map? It was undeniable proof. The evidence was just crystal clear. So he took his map, he went to the local officials, and he convinced them to do one simple thing: remove the handle from that pump. And what happened next? Just like that, the outbreak in Soho started to die down. It was a massive landmark moment in history. Think about it. By using a map and simple data to trace the source of the sickness, John Snow basically invented the science of epidemiology on the spot. And get this, the exact same methods, the same kind of disease detective work, are still being used today by places like the CDC and the World Health Organization. Which brings us all the way back to today. And here's the crazy part. We have known how to stop cholera for more than 150 years. It's not a mystery. The answer is clean water and sanitation. And yet, look at this number. 1.3 billion people worldwide are still at risk. It's a problem we know how to solve, but it just keeps hanging on, especially in places hit hard by poverty, war, and natural disasters. So I want to leave you with this final thought. Back in 1854, John Snow stopped a deadly outbreak with just a map and some shoe leather. Today, we have satellite imagery, genetic sequencing, supercomputers for data modeling. We have all these incredible tools. So the question is, what's holding us back from finishing the job? And that's our explainer on cholera. What do you think? Did any of this surprise you? Let us know down in the comments. We'd love to hear your thoughts. And hey, if you like these kinds of deep dives, make sure you subscribe so you don't miss the next one.